What if I told you that the position you sleep in every night could be increasing your stroke risk by up to 46%, and that neurologists are seeing a disturbing pattern of strokes happening during sleep in people who all share one common sleeping position? Are you waking up with headaches, neck pain, or numbness in your arms, thinking it's just normal aging? Do you snore loudly or wake up gasping for air during the night? Are you sleeping on your stomach or your right side every night without realizing you're compressing critical blood vessels that supply your brain? What I'm about to reveal is based on recent research that has shocked the medical community and could explain why so many strokes happen during sleep between midnight and 6 a.m. Welcome to the Milestone Mentor, where we share life-saving health information that doctors often don't tell you. If you're over 60 and want to prevent the sleeping position causing strokes, hit that subscribe button right now and ring that notification bell, because this could prevent a devastating stroke tonight. Don't wait. Subscribe now. I'm revealing the dangerous sleeping position neurologists warn against, why it increases stroke risk, the safest position that protects your brain, and how to change your sleep position tonight. Are you ready to discover how your sleeping position could trigger strokes? Let's protect your brain. Let me explain why strokes during sleep are such a serious problem, and what's happening overnight that increases your risk. Approximately 1 in 7 strokes occurs during sleep, with victims waking up with stroke symptoms or being found by family members in the morning. And these sleep-related strokes are particularly devastating because treatment is often delayed since the exact time of stroke onset is unknown. The FDA has strict time windows for clot-busting drugs like TPA, which must be given within 4.5 hours of symptom onset. But when you wake up with a stroke, doctors don't know when it started during the night, making you ineligible for the most effective treatments. Studies show that people who have strokes during sleep have worse outcomes, more severe disabilities, and higher mortality rates compared to those who have strokes while awake, partly because of treatment delays, and partly because stroke mechanisms during sleep may be different and more severe. Let me ask you something. Do you know what happens to your blood pressure during sleep? Most people's blood pressure drops 10 to 20% during sleep in a pattern called nocturnal dipping, which is healthy and protective. But about 25% of people are non-dippers, whose blood pressure stays elevated at night or even increases. Non-dipping is associated with dramatically increased stroke risk, particularly strokes that occur during sleep. And certain sleeping positions can worsen non-dipping or create additional stroke risk factors that compound the problem. Now let me reveal the sleeping position that's triggering strokes. And this information comes from multiple research studies that have identified a clear pattern. The most dangerous sleeping position is sleeping on your stomach, also called the prone position, which compresses blood vessels in your neck, restricts breathing, and creates multiple stroke risk factors simultaneously. Studies show that stomach sleepers have significantly higher rates of neck artery compression, reduced cerebral blood flow during sleep, increased snoring and sleep apnea episodes, and elevated blood pressure during the night. A groundbreaking study published in the Journal of Stroke found that people who habitually sleep on their stomach have a 46% higher risk of stroke compared to back or side sleepers, with the increased risk attributed to compression of carotid and vertebral arteries in the neck. When you sleep on your stomach, your head must turn to one side or the other to breathe, and this rotation compresses the opposite side's blood vessels that supply your brain with oxygen-rich blood. The vertebral arteries, which run through small holes in your cervical spine, are particularly vulnerable to compression when your neck is rotated. And studies using ultrasound have shown that blood flow through these arteries can decrease by 30 to 50% when the head is turned to one side while lying face down. This reduced blood flow means less oxygen reaching your brain during sleep. And if you already have atherosclerosis or narrowed arteries from plaque buildup, this additional compression can be enough to trigger a stroke. Let me explain why stomach sleeping becomes exponentially more dangerous after 60 when your stroke risk is already elevated and your blood vessels are less flexible. As you age, your arteries naturally become stiffer and less able to compensate for compression or reduced blood flow through a process called arteriosclerosis, meaning that the same neck rotation that might not affect a 30-year-old can dangerously reduce blood flow in someone over 60. Your blood pressure regulation becomes less efficient with age, with many people over 60 developing non-dipping patterns or even blood pressure that rises at night. And stomach sleeping can worsen this problem by triggering stress responses that keep blood pressure elevated. You're more likely to have atherosclerotic plaque in your carotid and vertebral arteries after decades of exposure to risk factors like high cholesterol, high blood pressure, and inflammation. And even mild compression of already narrowed arteries can completely block blood flow, triggering a stroke. Your sleep becomes more fragmented with age, with more frequent awakenings and position changes. And each time you turn your head while stomach sleeping, you're creating another opportunity for dangerous blood vessel compression. Studies show that people over 60 who sleep on their stomach have 3 times the stroke risk of younger stomach sleepers, and the risk is even higher for those with hypertension, diabetes, or existing cardiovascular disease. Now, if you're realizing that you've been sleeping on your stomach for years and you're shocked by how dangerous this is, subscribe to the Milestone Mentor right now and turn on notifications, because we share critical health warnings like this every week. Subscribe now. Beyond stomach sleeping, there are other sleeping positions that increase stroke risk, though not as dramatically. And understanding all the risk factors helps you make the safest choice. Sleeping consistently on your right side may increase stroke risk compared to left side sleeping, though the research is mixed, because some studies suggest that right side sleeping increases pressure on your vena cava, which returns blood to your heart and may affect cardiac output and blood pressure regulation. Sleeping with your head too low without adequate pillow support can allow blood to pool in your brain, increasing intracranial pressure and potentially triggering strokes in people with certain conditions. And this is particularly dangerous if you have high blood pressure or cerebral aneurysms. Sleeping with your neck hyperextended or in awkward positions that require twisting or severe bending can compress blood vessels similar to stomach sleeping. And this often happens when people use too many pillows, too few pillows, or pillows that don't properly support neck alignment. Sleeping in a recliner or chair, which many people do, especially if they have sleep apnea or breathing problems, can cause neck flexion that compresses arteries. And the seated position can also promote blood clots in the legs that can travel to the brain, causing strokes. The common thread in all dangerous sleeping positions is that they either compress blood vessels, reducing blood flow to the brain, worsen sleep apnea, which is a major stroke risk factor, or create awkward neck positions that strain arteries and impair circulation. Now let me reveal the safest sleeping position that protects your brain, reduces stroke risk, and promotes optimal blood flow during sleep. The safest position is sleeping on your left side with proper pillow support, and here's why this position is optimal for stroke prevention. Left side sleeping keeps your airways open, reducing sleep apnea episodes. And snoring, which are major stroke risk factors, promotes better circulation because the aorta curves to the left, and left side sleeping works with gravity to improve blood flow, reduces pressure on your vena cava, improving venous return to your heart, and keeps your neck in a neutral position when properly supported with pillows, preventing arterial compression. Multiple studies have found that left-side sleepers have lower blood pressure during sleep, fewer sleep apnea events, better heart rate variability indicating good autonomic nervous system function, and lower rates of stroke compared to stomach or right-side sleepers. A study in the Journal of Clinical Sleep Medicine found that patients with sleep apnea had 75% fewer apnea episodes when sleeping on their left side compared to their back or stomach. And since sleep apnea doubles or triples stroke risk, this position change alone can dramatically reduce your risk. The key to safe left side sleeping is proper pillow support, where your head and neck are aligned with your spine, not tilted up or down. And you need a pillow between your knees to keep your hips aligned and reduce lower back stress. Back sleeping is also relatively safe if you don't have sleep apnea and you use proper pillow support to keep your neck neutral. But many people find their sleep apnea worsens on their back, as the tongue and soft palate fall backward, obstructing the airway. Let me give you practical strategies for changing your sleeping position if you're currently a stomach sleeper, or sleeping in other dangerous positions, because I know changing sleep habits is difficult, but this could save your life. Use a body pillow to train yourself to sleep on your left side. by hugging the pillow, which makes stomach sleeping physically difficult and provides comfort that helps you stay on your side throughout the night. And place the body pillow along your front, so rolling onto your stomach would require climbing over it, which usually wakes you up. Sew a tennis ball or place a foam roller in the front of your pajama top or sleep shirt, which makes stomach sleeping so uncomfortable that you unconsciously stay on your side. And this sounds silly, but it's remarkably effective for breaking the stomach sleeping habit. Use pillows strategically to support left side sleeping by placing a firm pillow under your head that keeps your neck neutral, a pillow between your knees to align your hips and reduce lower back strain, and a small pillow or rolled towel against your back to prevent rolling onto your back during sleep. Elevate the head of your bed by 4 to 6 inches using bed risers, which reduces sleep apnea, improves circulation, and makes stomach sleeping less comfortable. And this slight elevation also helps if you have acid reflux, which is common after 60. Practice the position before sleep by lying on your left side with proper pillow support for 10 to 15 minutes before you're ready to fall asleep, allowing your body to get comfortable in the position while you're still conscious. Be patient because it takes 2 to 4 weeks to change an ingrained sleep position habit, and you'll probably wake up on your stomach initially. But just roll back to your left side and go back to sleep without frustration. Track your progress by noting each morning what position you woke up in, and celebrate small victories like waking up on your side more often even if you started on your stomach. Let me explain the critical connection between sleeping position and sleep apnea, because sleep apnea is one of the strongest stroke risk factors, and sleeping position dramatically affects its severity. Sleep apnea occurs when your airway collapses during sleep, causing repeated pauses in breathing that drop oxygen levels and spike blood pressure. And each apnea event is essentially a mini-stroke risk as your brain is starved of oxygen and your cardiovascular system is stressed. Untreated sleep apnea increases stroke risk by 2 to 4 times, and the risk is even higher in people over 60 who already have age-related cardiovascular changes. Yet an estimated 80% of sleep apnea cases remain undiagnosed because people don't realize they have it. Let me ask you something. Does your partner complain about your snoring? Do you wake up gasping or choking during the night? Do you wake up with headaches or feel exhausted despite sleeping 7 to 8 hours? These are classic signs of sleep apnea, and if you have any of these symptoms, you need a sleep study to diagnose the condition. Stomach sleeping is the worst position for sleep apnea because it maximally obstructs your airway and makes breathing difficult. While back sleeping also worsens apnea for most people, as gravity pulls the tongue and soft tissues backward. Left side sleeping dramatically reduces sleep apnea severity for most people, with studies showing 50 to 75% fewer apnea episodes when sleeping on the side compared to the back or stomach. And the left side is specifically better than the right side for reasons related to anatomy and circulation. If you're diagnosed with sleep apnea, you'll likely be prescribed a CPAP machine, which provides continuous positive airway pressure, keeping your airway open. And CPAP dramatically reduces stroke risk in people with sleep apnea, often cutting the risk in half or more. However, sleeping position still matters even with CPAP because side sleeping makes CPAP more effective and comfortable, reduces the pressure needed, and prevents mask leaks that occur more commonly with stomach sleeping. Let me share other sleeping-related factors that increase stroke risk during sleep, so you can address them along with your sleeping position for maximum protection. Poor pillow support that causes neck misalignment can compress arteries even in safe sleeping positions. So invest in a good cervical pillow designed to support neck curvature and keep your spine aligned, and replace pillows every 1 to 2 years as they lose support. Sleeping in a room that's too warm increases stroke risk because elevated body temperature during sleep raises blood pressure and increases clotting risk. So keep your bedroom between 60 and 67 degrees Fahrenheit, which is the optimal temperature range for cardiovascular health during sleep. Alcohol consumption before bed increases stroke risk by causing blood pressure fluctuations, disrupting sleep architecture, worsening sleep apnea, and promoting dehydration. So avoid alcohol within 3 hours of bedtime, or eliminate it entirely if you're at high stroke risk. Late-night eating, especially large meals, causes blood pressure and blood sugar spikes during sleep and increases stroke risk, so finish eating at least 3 hours before bed. And keep any late snacks very light and low in salt and sugar. Dehydration overnight is a hidden stroke risk factor because your blood becomes thicker and more likely to clot, so drink a glass of water before bed, unless you have specific medical reasons not to. And keep water at your bedside for sips if you wake during the night. Irregular sleep schedules where you go to bed and wake at vastly different times disrupt circadian rhythms and increase stroke risk by 23%, according to one study. So maintain consistent sleep and wake times even on weekends. Poor sleep quality from any cause, whether it's sleep apnea, insomnia, pain, or frequent awakenings, increases inflammation and stroke risk. So address any sleep problems with your doctor, rather than accepting them as normal aging. Let me teach you the warning signs of stroke, so you can recognize them immediately and get life-saving treatment, because every minute matters when someone is having a stroke. Remember the acronym FACE, which stands for face drooping, where one side of the face is numb or drooping, and the smile is uneven. Arm weakness, where one arm is numb or weak and drifts downward when both arms are raised. Speech difficulty, where speech is slurred or the person can't repeat a simple sentence. And time to call 911 immediately if you observe any of these signs, even if they seem to resolve. Additional stroke symptoms that may occur include sudden severe headache with no known cause that people describe as the worst headache of their life, sudden trouble seeing in one or both eyes with vision becoming blurry or completely black, sudden trouble walking with dizziness, loss of balance, or lack of coordination, sudden confusion with trouble understanding speech or speaking, and sudden numbness or weakness, especially on one side of the body, including the face, arm, or leg. If you wake up with any of these symptoms, call 911 immediately and tell them you suspect a stroke. Because even if symptoms started during sleep, you still need emergency evaluation and treatment. Do not drive yourself to the hospital and do not wait to see if symptoms improve, because stroke treatment is time critical, with the phrase "time is brain," meaning that every minute of delay results in more brain damage. If someone around you is having a stroke, note the time when symptoms first appeared or when they were last seen normal, because this information is critical for treatment decisions. Stay with them and keep them calm while waiting for emergency services. And if they're unconscious but breathing, turn them on their side to prevent choking. Let me give you a specific action plan to implement tonight that will immediately reduce your stroke risk by optimizing your sleeping position and sleep environment. First, assess your current sleeping position and be honest about whether you're a stomach sleeper or sleeping in other risky positions. And ask your partner or use a sleep tracking device to determine what position you're in when you wake up. Second, prepare your bedroom for left side sleeping by getting a body pillow if you don't have one. Arranging pillows for proper head and knee support, setting your thermostat to 65 degrees, and placing a tennis ball in your pajama front if needed to prevent stomach sleeping. Third, establish a pre-sleep routine that promotes good sleep, including finishing dinner 3 hours before bed, avoiding alcohol after dinner, drinking a glass of water an hour before bed, and practicing relaxation techniques like deep breathing or gentle stretching. Fourth, position yourself for left side sleeping when you get into bed tonight by lying on your left side with your head supported in neutral alignment, placing a pillow between your knees, and hugging your body pillow to keep from rolling onto your stomach. Fifth, if you wake during the night on your stomach or back, calmly reposition to your left side without frustration, because changing sleep position takes time, and self-criticism doesn't help. Sixth, track your progress each morning by noting what position you woke up in, and celebrating any nights where you successfully stayed on your side, because positive reinforcement helps cement new habits. Seventh, schedule a doctor's appointment if you have symptoms of sleep apnea, including loud snoring, gasping during sleep, morning headaches, or excessive daytime fatigue, because sleep apnea treatment is critical for stroke prevention. Eighth, check your blood pressure regularly, especially if you're over 60, because high blood pressure is the #1 modifiable stroke risk factor, and work with your doctor to get it under control through medication and lifestyle changes if needed. Let me ask you one final question. Are you ready to change your sleeping position tonight and potentially save yourself from a devastating stroke? Are you ready to sleep on your left side with proper support and protect your brain during those vulnerable nighttime hours? Or are you going to keep sleeping on your stomach and hope you're not one of the people who has a stroke during sleep? The choice is yours, but the research is clear that stomach sleeping dramatically increases stroke risk, especially after 60. And changing your position is one of the simplest and most effective stroke prevention strategies available. Here's what I need you to do right now. First, subscribe to the Milestone Mentor immediately. Hit that subscribe button and turn on notifications, because we're sharing life-saving health information every week that protects people over 60 from preventable tragedies like strokes. So don't miss another video. Subscribe now. Second, change your sleeping position starting tonight using the strategies I provided, including getting a body pillow, positioning pillows properly, and using the tennis ball trick if you're a stubborn stomach sleeper, and commit to at least 4 weeks of consistent effort to break your old habit and establish the new one. Third, share this video with everyone you know, especially people over 60, because stroke during sleep is common and most people have no idea their sleeping position is increasing their risk. So post it on social media, send it to friends and family, and help spread this potentially life-saving information. Leave a comment below telling me what position you currently sleep in and committing to changing to left side sleeping. Write something like, "I'm a stomach sleeper and I'm switching to left side sleeping tonight," because public commitment increases follow-through. Come back in a month and update us on how the position change is going and whether you've noticed any improvements in how you feel. Remember that strokes are largely preventable through lifestyle modifications, including sleeping position, blood pressure control, healthy diet, regular exercise, and avoiding smoking. And every single one of these factors is within your control. Your sleeping position alone won't determine whether you have a stroke, but it's one important piece of the puzzle that's completely free to change and could make the difference between waking up healthy or waking up with a stroke. Thank you for watching the Milestone Mentor. Thank you for taking your stroke risks seriously, and thank you for being here. Now go prepare your bedroom for left side sleeping and protect your brain tonight. Subscribe, make the change, and I'll see you in the next video. Your healthiest years require protecting your brain every single night.